Welcome to Dentistry online channel. Today, our topic of lecture is cysts of oral cavity. So what is a cyst? A cyst is a pathological cavity having fluid, semi-fluid or gaseous contents and which is not created by the accumulation of pus. Now the characteristic features of cyst. Most cysts, but not all, are lined by epithelium. May occur within the bone or soft tissue. Asymptomatic or associated with swelling and pain. Cysts are generally slow-growing, expansile lesions, and they grow by hydraulic expansion. Next is radiographic features of cysts. Radiographically, they often appear radiolucent surrounded by thin radio-opaque border. As you are seeing in X-ray. Red arrow is showing towards a large cyst in mandible.
Next is types of cysts. There are two types of cysts in oral cavity: true cysts and pseudocysts. True cysts are that which are lined by epithelium. Examples of true cysts are dentigerous cyst, radicular cyst. Pseudocysts are not lined by epithelium. Examples of pseudocysts are solitary bone cyst, aneurysmal bone cyst.
Now what are the parts of cyst? Cyst is comprised of three parts. Outermost part of cyst is wall of cyst, which is made up of connective tissues. Inside the wall there is epithelial lining which may be keratinized or non-keratinized. Innermost part of cyst is called lumen of cyst. Lumen of cyst contains fluid of cyst. Now the classification of oral cysts. Cysts of oral cavity can be broadly classified into two types of cysts: epithelial cysts and non-epithelial cysts. Epithelial cysts can be further classified into developmental cysts and inflammatory cysts. Developmental cysts are further classified into odontogenic cysts and non-odontogenic cysts. What is odontogenic cysts of oral cavity? These are cysts that are formed from tissues involved in odontogenesis or tooth development. Odontogenic cysts are dentigerous cyst, odontogenic keratocyst, orthokeratinized keratocyst, eruption cyst, gingival cyst of newborn or infant, gingival cyst of adults, lateral periodontal cyst, botryoid cyst, glandular odontogenic cyst, and calcifying odontogenic cyst. Next is non-odontogenic cysts of oral cavity. These cysts arises from epithelial remnants of embryonic ducts left behind after embryonal facial and jaw development. Names of non-odontogenic cysts are nasopalatine duct cyst, median palatal cyst, globulomaxillary cyst, median mandibular cyst, nasolabial cyst, thyroglossal duct cyst, epidermoid cyst, dermoid cyst, and oral lymphoepithelial cyst. Inflammatory cyst of oral cavity are radicular cyst, periapical cyst, residual cyst, paradental cyst, and inflammatory collateral cyst. Next is non-epithelial cysts. These cysts are devoid of any true epithelium. Examples are solitary bone cyst and aneurysmal bone cyst. That's it for today. Thanks for watching and listening. Don't forget to subscribe our channel on YouTube for more lectures.